And I just want to make a few remarks. I know others will join us for the social this evening, but thank you for being here, those of you who are here now. And we are so excited that Dr. Crooke is going to be our president-elect, officially May 11th. And so that is going to make her the president of the HCMA in May of 2022. She is the third female president in HCMA history.
Oh, I didn't realize it was only number 3.
Yes, yes. And I don't know about the youngest, but could be. And
how many years is that, Elke? How long's HCMA been around?
1895.
1895.
18.
Yes, ma'am.
Wow, that's impressive.
This year.
Wow, 1895.
And is chair of our government affairs committee, and so legislatively she just dove in this past year when Dr. Cromer handed over the reins to her, and so we're very excited about her upcoming presidency and just working with her now, all the things that she's been doing. So thank you, Dr. Crooke.
Of course, thank you so much for the introduction. I really wanted to just keep tonight pretty informal. We've been trying to do more with the women's section in the HCMA just to really get to know each other and kind of share the unique things that we experience as women in medicine. I actually have to ask, obviously I know Madeline Butler is one of the other 2 female presidents. Who is the 3rd person?
Renda Knapp was the 2nd female.
Interesting.
But she served from May until December.
Oh.
And then unexpectedly, her family, they moved to Virginia. I think her husband accepted and had a job transfer. And so Dr. Bruce Shepard was president-elect at that time. So he took over early and served for a year and a half, or almost a year and a half.
Little fun facts of the HCMA. Well, Renda Knapp was also an OBGYN, just like Madeline Butler, and she was part of the same practice before I was there. So I guess there's a theme, and you guys probably can guess then how I got involved initially. I figured I would just introduce myself personally so that way we could try to get to know each other better and hopefully still foster the women in the HCMA relationship. I'm technically a local. I was born in the Tampa Bay area. I'm from St. Petersburg and spent most of my childhood years in St. Petersburg and then Seminole. Graduated from high school there and then went to Florida State for my undergrad and USF for both medical school and residency. So I never made it very far away from Tampa and have stayed in Florida the whole time. I'm private practice OBGYN with Dr. Madeline Butler's group. And so she's actually who introduced me to organized medicine. I wasn't very familiar during medical school and residency. We, as an organization, have tried quite hard to reach out and get more students and residents involved so that they're at least aware of what organized medicine is and the opportunities that it can provide. That's something that I hope to carry on as an initiative to really keep them involved. Sometimes I feel like I was a little late to the game, even though I did join once I joined the practice. But even just understanding the nuances of how organized medicine works and the ways that we can be involved together, both legislatively and just in the community, it took a little while to really understand. And had I been involved a little bit earlier, I think I would have had a better grasp. Dr. Butler is very into organized medicine. She actually just shared recently through our practices Facebook page and other social media accounts a photo of her in the 1980s when she first got involved in the student section of the AMA. She found organized medicine pretty early and stayed involved. When I joined the practice, I think when everybody joins her practice, we all do become members, some of us a little more engaged than others. And she really took me under her wing and said, I want to have somebody that can carry on for our practice, because as a private practice group, we've had so many benefits from being involved with both the HCMA and FMA beyond even just the legislative affairs. And once I was able to see, the tangible value to the practice, I understood why it was so important. I'll be honest, legislation and anything legal, bills going through, politics, never involved, never interested before this. certainly I would put that pretty low on my totem pole of interests as a person, growing up and in my college and medical school days. So I've had to learn a lot about the process, which she's helped with, and the HCMA and the FMA really help with as you watch the different bills and the different things go through. I still think I have a lot of learning to do, but that's the area of the HCMA I'm most involved in with the Legislative Affairs Committee, where we actually get to meet with local legislators and either educate them on bills from other interest groups that are being proposed, or try to actually have them sponsor bills for us. I was going to give just a very brief recap of where we are right now, since the legislative session, I believe, is going into its last 1 or 2 weeks. We have some medicine-friendly bills that were passed that the FMA supported, and they were able to not necessarily defeat some scope of practice bills that were on the docket, but they were able to at least get amendments to try to protect physicians practicing medicine instead of other mid-levels and other types of specialties. And so this year, the focus of both the HCMA and the FMA were kind of in 3 different areas. First was going to be COVID-19 related. I think that's something that we can all relate to, both the impact on our patients and then on practices. And the FMA very strongly supported a bill to try to protect patients from liability as it revolved around COVID, whether it was from missing diagnoses, late diagnoses, other care getting backlogged or delayed because of COVID-19, for example, surgical delays. And so it's actually passed through the bill as the Senate Bill 72 that helps to protect physicians. And it's actually already been passed by both houses and signed into law. So it actually moved through faster than the typical bill would. And it just contains some protections so that we can try to prevent any liability from physicians or offices as it relates. And so that was a really big win for both locally and at the state level. For scope of practice, there were 4 bills in total that were being evaluated by both chambers. One that related to autonomous practice by nurse practitioners, another regarding physician assistants, another regarding optometry and their ability to do some surgical type procedures, and the psychologists who wanted to have some prescribing benefits. There are 2 that are still active that we don't have a position yet on, and that's related to nurse practitioners and the psychologists, but the optometry and PA bills have actually been moving forward with some amendments that are more favorable for physicians. The PA bill originally had autonomous practice written into it, like the nurse practitioner bill that passed last session, but the FMA was able to get some amendments added so that they are not going to be able to have autonomous practice. It did lower the ratio, of physician requirement to the number of PAs that can be supervised, but at least it kept independent practice for PAs for the time being out of the law for this coming year. The optometry bill has also been amended to try to limit the types of procedures that can be done. They were originally asking for eye surgeries and laser procedures, and some amendments were added that really specify which procedures are acceptable and which aren't. So again, not exactly what the House of Medicine was trying to push forward, but at least amendments that are a little more favorable. The other things that were on the bills that we were really following and pushing for: telemedicine and trying to keep telemedicine available to us, as well as payment parity, in hopes that we could get insurance companies to want to cover telemedicine, whether it was with video or audio only, at the same rates that we're paid for in-person visits. I think COVID-19 really pushed through the use of telemedicine to a different level, even though it had started long before that. And right now, the bills are being amended to not exactly what we wanted for payment parity, but they are allowing for continued services, as well as certain provisions for prescribed and controlled substances in physicians who have long-term relationships with patients. And both the House and the Senate are moving through a lot of those through their committees, and they look to be favorable to us, even if they don't contain a payment parity component on this session. There were also some bills that unfortunately we worked very hard to get sponsored locally. There was a retroactive denial bill to try to prohibit retroactive denials, prior authorization bills to try to streamline the process and make them a little bit more favorable for rules for physicians and patients, and then a bill regarding overpayment of claims and the time frame that insurance companies have to revoke any payments that were made. All three of those seem to be, I guess the term I learned this session was dead in the water when I asked a legislator what exactly that meant, that basically these bills weren't going to be going beyond the committee level. When we asked a little bit more, we found out that there are very deep pockets with the insurance industry lobby area, which I don't think we're really all that surprised by, but these tended to be the bills where they pushed back the most. Scope of practice is another place that insurance companies and hospital associations often favor because they look at it as a cost benefit for paying mid-levels as opposed to physicians when it comes to who's providing the care. But it seems that this was where they really dug their heels in and pushed back the most. And so as of right now, it doesn't look like any of those will go forward this year. I actually have a meeting set up that Dr. Cromer set up for me and invited me to with the author of the retroactive denial bills here locally, Representative Susan Valdez. And we also have a, I'm not sure exactly the title of the person joining us, but they are from the insurance industry lobby because we were basically recommended to try to set up a meeting to understand their side of what their opinion of these bills are, how it affects them, and why they push back to us. I think it's an interesting idea for a meeting. I don't know how productive it may or may not be. I haven't had any experience other than just meeting directly with legislators before. So I'm hoping at least being able to talk to and reach out to the other side to understand what it is that we're often fighting or the differences in ideals for where these bills go may be helpful. So that's as much as I know about everything going on this year in the local Florida House and Senate, and we'll keep tracking as we have a couple more weeks to go before we find out everything that the FMA and HCMA are following. Does anybody have any questions about anything that we've been doing, working on?
Pretty impressive for someone that didn't want to know anything about legislators.
So I was just going to say, you are a wealth of knowledge. And with that, I would like to do a toast to our Madam President, upcoming president, everybody. Let's toast our new president. Hear, hear.
I do only have water today, but I will definitely bring wine next time because I see it on almost every screen. Dr. Johnson, do you have
Yes, yes.
No. You know, the other things that the HCMA really has tried to focus on more in recent years that I was able to be peripherally involved with were the Physician Wellness Committee, which is something that I definitely felt very strong and supported. I haven't myself used it yet. It was on my radar of I really wanted to see what the program itself provided to be able to give some feedback. It still is something I will hopefully do. Physician wellness has really been on the radar, I would say, for at least the last 2 years as something that a lot of groups, including organized medicine, are focused on. Our amazing leadership in Debbie and Elka kind of brought the idea to the executive committee. Was it about 2.5 years ago now, I think?
It's been longer.
Is it really? I have a time warp for sure.
The process years ago.
I guess I could take COVID year out of it. So it was probably about 3.5 years ago now that the idea came about. There were some other organized medicine groups, I think it was specifically in Oregon, that Debbie had familiarity with that had created a physician wellness program as a benefit for their members. A lot of people know about things like their employers may have like set up, gosh, I'm blanking on the acronym, basically EAPs, employee assistant programs that have supposedly anonymous benefits for things like counseling or reaching out if there were substance abuse issues, education if there was financial issues, but physicians, along with a lot of other people, are skeptical that it's ever really anonymous. And so we wanted to provide something that would be completely outside of a practice or an employer, but would still be in a community that we feel comfortable with in our fellow physicians in organized medicine. So the Physician Wellness Program provides for sessions with either a licensed clinical social worker, we have a few actual psychologists and other licensed counselors, where they're available within a very short amount of time when we send a request in. It's completely anonymous, and we only know how many people use the program. We don't know anything about the statistics of who use the program. And the HCMA actually started a fund with a lot of different people and organizations donating to it, so that way it's covered entirely for the physician that needs it. There's a total of 6 sessions, which I believe a session is usually roughly an hour, give or take, from the provider that's giving the service, and up to 6 can be covered in a year. We created it as an endowment in hopes that it would help to kind of fund itself over time. And if anybody does ever want to continue contributing or make a contribution just on a one-time basis, it can help keep that fund going. I know we have had use. I haven't actually heard recent metrics, but I know in the first, I want to say it was 6 months to a year, we did see that we had use. We had a few people using 1 or 2 sessions, and the studies that Debbie provided from the other organizations that use it, most physicians that ended up using their program would get about 3 sessions on average. Occasionally they would need only 1, sometimes they would use all 6. And that's how we determined a budget, if you will, for what we tried to raise to get the program off the ground. It's through our website is one of the ways that you can actually find a provider. You can read the profiles of the people that we interviewed and offered an association, and kind of pick who you think would be a good fit, and then reach out directly. And they usually will see you. There's a few variations, but it's usually within 48 to 72 hours, they'll be able to set up an appointment. And so far the program has been great. And like I said, I really do have all intentions of trying it. We'll get around to it. I'll try to do that before I actually start as president. I think if there's any feedback or any review that I can give, we may be able to tweak the program to make it better. And I think potentially talking a little bit more about it when we go back to our in-person meetings, just to make sure our members are aware. Sometimes, with all of the emails and magazines and literature that we get, sometimes we don't really see all of the details. And I just want, our docs to know that we have something available that really is anonymous. And if I can say that I've done it myself, sometimes that holds a little bit of value for people wanting to pursue if they're concerned about the anonymity or being able to get something valuable from it. I was reading about wellness in preparation just for tonight, because I think it's always good to pull back and remember that we have to have a balance. And one of the most interesting things I saw was that work-life balance is probably not the right term to use, and it's work-life harmony. And it sounded a little cheesy at first when I heard it, and I thought, oh boy, you hear so many things. And the more I read the article that I was reading, I really thought that was a good answer. The balance is not ever the same. And I think that's what it really meant by harmony, that there's going to be different times in your life where it's okay to, add a little more time into work and really throw yourself in. If you're looking for a position change, or you're trying to move up, you're newer and establishing a patient base, but there's also times where we have to give ourselves permission to pull back a little bit, or to modify and put a little more time into our life side of the equation. So it really made more sense the more I thought about it, and I decided it wasn't too cheesy to share tonight, because I thought it was a really important message about trying to kind of shift our focus on always being a balance, and knowing that that balance doesn't have to be the same as we're at different points in our career. So I just thought that was a little tidbit that I wanted to share. And there's a great blog that was actually started by 2, I'm not sure if they were medical students, or I think they were residents when they started. They're now both emergency medicine physicians. It's called shemd.org. They're actually local, relatively. They're Floridians, and they did their training at the University of Florida. And they created a website specifically for women in medicine at different phases. You can actually go onto their site, and they have, like, for example, a medical student section, a resident section, and it focuses on a lot of the work-life balance, the wellness, trying to pick a specialty, understanding how women are affected differently in medicine, what biases may exist, how the specialties are different when it comes to thinking about a family. So I just thought it was a great resource, and found it when I was reading along for just wanting to talk a little bit about, what's unique for us as women in medicine. That's really all I had put together, since this hopefully was going to be more informal to get to know each other a little bit better, but I'm happy to answer any questions, or if anybody has anything new and exciting going on in their lives, we'd love to hear that too. My husband just wanted me to share how I met my husband. He took the journey all the way through medical school and residency and early practice with me. So he's been a trooper. He's not in medicine. He works for a financial firm doing some of their accounting. We actually worked together in college in Florida State. We worked at a yogurt shop together. So he was the store manager and I started working there, I think my sophomore year, and I worked there through the rest of the time we were in school together. And he took the leap of faith and moved to Tampa with me when I started medical school. So he wanted me to share, I guess.
Well, Florida State, I mean, they really have some strong medical students as far as involved with the FMA. One of them, Ian Moti, actually has written now 2 resolutions with the student group at FMA, and one on racism, and I think the other on the ACA that they're going to be presenting at FMA. But they have a strong, so you come from a strong group of students at FSU as far as, you know, politics and advocacy and getting engaged. And, you know, it's really, we need more young people to do this. You know, we need to get them out of their comfort zones and mentor them along. So I really applaud you.
Getting out of my comfort zone. That description was perfect. That's exactly what Dr. Butler did. She flicked me out of the nest and said, you got to get uncomfortable.
Well, that's good.
And somebody in our practice, you know, I really want somebody in our practice to be very involved because I think it's so important. And for the viability of if we can, you know, stay as a private practice, there's a lot of value into what she showed me. So I said, okay, I'm willing to do it. I'll learn, get involved. But you're right. I think trying to get some younger, you know, people involved, it's tough. I mean, you hear very similar stories a lot. It's either young kids, it's starting a practice where you're really diving in and trying to commit a lot of time early. But really, I can tell you the commitment is as much as you want to make it. I guess that's another huge piece of wellness is saying no, you know, don't overextend yourself and you really have to prioritize what things are worth your time, and realizing that you don't have to be absolutely everything that everyone wants you to be. Sometimes there's a snowball, you get involved and, you know, then the next organization's interested because they see you're involved, and sometimes it can be hard to find people that stay engaged and want to commit. Perfect example, I'm part of the USF Med Schools Alumni Association, and as I became more involved in the HCMA, they thought, oh great, you know, she'll maybe become more involved in the College of Medicine Alumni Society too, and I would love to, but I had to finally just say, you know, not right now, not while I'm significantly involved in the HCMA. I don't want to spread myself too thin. Saying no is tough, not necessarily in my personality. You know, you want to kind of, you don't ever want to let anybody down. And I think you have to remember that it's okay, you know, to set those boundaries and say, right now, I just can't commit. And maybe at a later time, and I'd like to at least stay on, you know, still get information from you, but saying no is valuable. It was still very hard for me to do, but I try.
Good evening, Dr. Steen. How are you? Welcome.
Unmute.
You unmute yourself.
Maybe she's having some audio issues.
You could click on the little microphone that's red. Click on that.
Well, I am looking forward to the in-person FMA meeting. You know, we did the annual meeting last year with the AMA, the interim meeting, excuse me, was virtual. It was impressive to see how they put together. It was Zoom plus another platform that was specifically for voting. And I want to say that they said there were several thousand people involved, and I was impressed. It was quite the feat. I had never seen anything like the breakout rooms and the way they were able to use the platform, but it was pretty impressive. But I am looking forward to getting back to some in-person meeting. If there's something about that I miss, and hopefully we can do it in a safe way and enjoy Orlando at the same time. Aha.
I don't think the FMA, they're not going to have like an FMA dinner, you know, on Saturday evening. They usually do.
The installation will happen during the House of Delegates, and they're going to bypass the FMA dinner and celebration. So, so we'll probably have our HCMA delegates dinner on Saturday instead.
That would be nice. Yeah, I think we have to do sort of a hybrid version this year where I'm sure during the House of Delegates, they'll ask us not to eat and drink regularly and wear masks and try to space out as much as we can. But it would be nice to at least have the hybrid version of an in-person meeting.
Yes.
The AMA did have to commit to another virtual because Chicago's rules were not established for them to be able to do anything in person. And so we'll have another virtual meeting for that.
No, I don't know everybody on this call. I think some of the older folks, we know each other, but I'd like to hear little introductions from everyone.
That'd be great.
Who's going to start? Bonnie, you can start.
Okay, I'll start. I'm Bonnie Sachs. I'm a psychiatrist. I actually I graduated from medical school at Brown University. I've given a commencement talk there. I'm a clinical professor of psychiatry here at USF, but I have private practice. I used to have, I graduated from Brown and I did both OBGYN and psychiatry residencies at Yale, yikes, and a sex therapy fellowship there. And then I came down here with my first husband, who didn't work out very well, but made me 2 great children. So I have now 4. I came down while I was a week after my second child was born, who was born a year after my first child, on my birthday. They were both born on my birthday and on the weekend, so I could work Friday. And I flew down to Tampa with my 2 little kids and took my psychiatry boards, which were on the same day as my due date. So I did have to evict my second child a few weeks early. But then I passed my boards and had my kids and came down here and started practicing psychiatry and sex therapy. I've been with the university a little bit teaching medical students about sex. And now I've kind of switched over to, being a new grandma, I've switched over to kids. So I think Moira and I are very involved with Champions for Children. And I want to take this opportunity to give my little spiel of how important Champions for Children is to you, especially you OBGYNs and pediatricians. We did give a little talk, a lunch and learn with Catherine Lynch about Champions for Children, but it's just so important because I worked with Sally Province at Yale a little bit with realizing that if kids do not have attachment early on, they're both cognitively and emotionally depression. And we know that 40% of kids, 50 to 60% of kids are not learning ready by kindergarten. So we have to make those interventions early. Champions for Children has lots of resources, but people don't know about it enough. So Moira and I are doing kind of an outreach, since we're both on the board, to especially to you guys. And we want you to, they have a warm line that any parent can call. They have parent positive on the block and all kinds of great family teaching, fathers groups, all kinds of really good stuff that is really important. Diapering classes, breastfeeding classes, all kinds. They have doulas that go home with the mother to help build attachment, and they make these really good interventions with kids. So and parents. So tell your clients about Champions for Children. So I'm glad I got to do that plug. I'm sorry for talking so long.
No, thank you. It's always good to know, resources that are available to us, and having a person that's a contact in it is great too.
I'll go next. I'm Sandra Ellis, and I'm coming from Michigan, where I did have private practice there, but I moved down to Tampa, and I am currently an employed physician with Tampa General. I work in the outpatient primary care, and I definitely have been involved, not so much in the Florida area, but definitely up north in terms of the different organizations and seeing what does affect women and minorities. And of course, this has been more brought to a head with the pandemic. But I think that one of the things that seems to resonate is the work balance and what activities women we really feel we can do and what we feel expected to do. And I think that it's important to have a common voice for that. And so I'm really, at this point, not on many committees of any sort, but, you know, I like what I hear tonight. And I know that before I had sat in on the environmental about 3 months ago, right, when HCMA had another conference on how the environment is impacting us. And I think those issues do need to be addressed and not pushed under the rug, because a lot of work does need to be done. But no, I'm a transplant, as they say, and I really do think that Tampa is going to have a lot of very positive things going on in medicine. So that's my really good. Mm-hmm.
Welcome. Yeah. I can go next. I'm Moira Burke. I'm a recently retired ophthalmologist. I came to Tampa in 1975 after training in Philadelphia and practicing there for a year. In 1975, the landscape was very, very different for women, and Elke and Debbie can maybe remember some of those years. There, I think when I came, there were only a total of 3 female physicians. Nancy Brummer was an OBGYN, and there was Jan Judish was in pediatrics out at USF. And then as the years went on, more women began to move here, and we started small groups to help people. Basically, we just would get together and bellyache, and but it was really helpful, and I think that's how I first met Bonnie when she got here. My passion for the Champions for Children is the same as hers. It's just the best run organization I have ever seen, and it has so many services for women and men and children. There is no financial requirement. I think the only requirement is to live in Hillsborough County. So it is something really valuable for you to look at. Well, like Bonnie, my son was born on my birthday, and that was during my residency. And like Bonnie, there was no such thing as maternity leave. And right back to work. He became a physician, and he did go to the University of South Florida for medical school. He was the first son of a woman physician to graduate. And it was just a real delight because there were so many sons and daughters of male physicians. But when he graduated, the dean at the time asked if I would like to put him. And I did. And he just picked me up on the stage and twirled me around, and all the girls in the class gave him a standing ovation. It was probably one of the best days in my life. Anyway, I had something like 34 years of private practice, solo practice. And then I was recruited over to USF to teach cataract surgery to the residents, which I did for 6 years. And that was lots and lots of fun. After, I had to stay home after that because my husband was terminally ill. After he died, I went back and worked in other people's offices and mainly, certainly non-surgical work, but I just retired this past September. So it's been a long career and a fun career. I wouldn't trade it for anything. And I'm so excited to see women moving to the forefront like you are, Eva, and you have, Rebecca. It's just wonderful. Congratulations.
Well, I'm Lynn Ringenberg. I came to Tampa Bay in 1980 in private practice. I trained at UF and then for 2 years and did my last year up at Bowman Gray, and was in private practice for about 13 years in Largo and Clearwater, and then was recruited by Jaime Frias to join USF in pediatrics. I'm a pediatrician. So I came to USF and combined had, well, with the 13 years in private practice, about 40 years, I guess, total. But I practiced at USF for a little over 25 and had a parallel career in the military. And so I was in the military for 25 years as well, which I loved. And while at USF, I was division chief. I was the residency director for pediatrics for many, many years. I was the founding pediatrician with Phil Altus of the combined internal medicine and pediatrics program at USF, which is still going strong. One of the really two in the state of Florida. And then when I was still practicing, realizing that so many of my kids were, getting sicker from, asthma and different kinds of things, developmental issues and behavioral problems. And I said, something's going on here. So I started researching it, and I ran into Physicians for Social Responsibility. And so I started a chapter here in Florida, actually in Tampa Bay in 2008. We started a student chapter at the same time in 2008. That's still going strong. As a matter of fact, I just got an email from one of the students. We're going to get together next Friday and chat. But so we expanded to the whole state of Florida in 2012, and that's a nonprofit that works on environmental issues. And I can say that we sound like we've had some positive wins up in Tallahassee on the medical side of the house. I can tell you on the environmental side of the house, it's been all down. It's terrible. It's disastrous what's happened on the environmental issues that are going to impact all of us. So anyway, I started a PSR, and then it's a nonprofit that really looks at the things that we feel are the gravest threats to survival of the human species, and that's climate change and nuclear weapons, nuclear war, and also looking at environmental toxins. We're working right now with the community groups and the Department of Public Health on the gopher lead toxicity, poisoning to all those workers there. And I'm sure you've all read that Tampa Bay Times article on gopher, but that's a real travesty. So anyway, that's what I do. I'm still teaching with the medical students. Matter of fact, this year, I must say, we had our first time in the school's history of being able to introduce a curriculum on climate change, the climate crisis, and harms to human health. It started in December, and I just wrapped up last week with about 120 students that just did an outstanding job researching and coming up with how what we're seeing in our climate is affecting the health of their patients, their families, et cetera, their communities. So that was really fun, and we're going to start it again in June. And then I also do some consulting for a medical school in Grenada. So that's fun. Keeps me connected to the academic side, and which I enjoy. And other than that, I don't have kids. I have fur babies. So I have 3 wonderful Cairn Terriers. And so that's my life. Busy and enjoyable.
Good. I want to be your friend. Let's have a drink.
I'll toast to that.
Susan, you want to go?
Sure, I'll go. So I'm Susan, and I I actually grew up in Tampa. I moved to Tampa when I was 5 years old, so I've been in Tampa a long time. I did my medical school at University of Florida and did 2 years of internal medicine at University of South Florida. So I was hanging out with Phil Altus too, and some of those wonderful people back then. And then I went back to Gainesville and did my residency in neurology and came into practice here in 1983 and have been with Tampa Neurology Associates since that time. So we do adult neurology. My interest is in degenerative neurologic illness. So I'm a general neurologist, but a lot of my work is with dementia, patients with dementia, and Alzheimer's disease, and other neurodegenerative type issues. So I am very involved in clinical research. I have a clinical research company, Axiom Clinical Research, and we do trials in multiple sclerosis and a lot of my trials as the principal investigator is with Alzheimer's disease and Lewy body dementia, and hopefully now with frontotemporal dementia. So that's what I do, and I agree, you know, with the discussion that Moira brought forth about how things were very different back in the 80s and for us. And it's just so exciting now to have so many women in medicine. I just hooded my daughter, who graduated from Alabama College of Osteopathic Medicine last May, and she's headed to NYU to do a residency in PM&R. So that's exciting, and I'm so glad to see you all tonight.
So a toast to your daughter. Good for her.
Thank you.
I'm out of wine.
Sorry, I don't have a glass of wine.
Gotta fill that puppy up.
She's the best neurologist in the city. She has diagnosed patients of mine who were not schizophrenic. One had Pick's disease. Nobody else could figure it out. Susan is so smart and so capable, and I really appreciate having her.
Yes.
So I'm Rebecca Johnson, and I'm really enjoying hearing everybody's stories and getting to meet some of you for the second time. I have lived in Tampa since 2012. I moved down here in August. The week I moved was the Republican National Convention and a hurricane warning. So welcome to Tampa. I joined the HCMA right away because I'm a real believer in organized medicine and have been involved since my medical student days. I'm currently the Chief Executive Officer of the American Board of Pathology, which, believe it or not, is located here in Tampa, Florida. So I've been CEO of the board since 2013, and will be stepping down at the end of this year. I'll probably stay on part-time, but I will no longer be the Chief Executive Officer. So I'm looking forward to that, having a little more time and hopefully being able to travel. I grew up in rural Minnesota on a farm. I went to Southern Illinois University School of Medicine when it was a brand new, absolutely amazing medical school. Did my residency at Hartford Hospital in Connecticut in pathology, anatomic and clinical pathology, and stayed on there. I did a visiting fellowship at National Institutes of Health, and then went back to Hartford Hospital and was on faculty there for 6 years. Then I went over to Rhode Island Hospital and Brown University and was on faculty there for a few years. So we have something in common, Bonnie. And then was recruited to Berkshire Health Systems in Western Massachusetts, the prettiest part of Massachusetts, and was there for 22 years, 20 as department chair and a residency program director. And I served on our board of pathology, American Board of Pathology. And so when the CEO job came open, I thought, well, it was a good time for a change for me and for my department. So here I am. And I love what I do, but I am looking forward to doing a little bit less of it. I don't have any kids. I didn't get married till I was 52. So it was a little late to start. My husband's a retired IBM executive, and he's my support system, does a lot of good things for me. So again, it's been really great to get to know you all, and I hope we can see each other and get together face to face, and we can have some nice event for the women physicians.
Yes, be nice.
Well, I'll go next. Real quick, Elka Lubin, Executive Assistant. Been with the HCMA for just over 33 years.
Woo, wow.
So I've, Debbie and I have seen the change in medicine. Obviously, we were right there with you ladies. So we've seen how it's changed so much. And one little note, Nancy Broomer was mentioned earlier. And I believe that when my mom was in the hospital delivering, Dr. Broomer delivered me.
Oh, yeah. He was a wonderful person, a lovely person.
So that's my story.
Well, I'm Debbie Zorian. I'm your executive director, and originally from Chicago, moved down here. Very, very young mommy with two little tiny girls back in 1979. I am very, very proud and honored to say that I just celebrated my 35th year here at the HCMA just last month. So, like Elka said, we have been through it all, and the changes in the last 3.5 decades have been. It's almost like when I retire from HCMA, I'd love to write a book, because it's just unbelievable. As you know, the changes in the profession of medicine. I have 3 children and 4 precious grandchildren, and a little fur baby who is so sweet. It's unbelievable, Zoe Zorian. But my dedication and my passion for the HCMA to serve the Medical Association and its members for this long. And I love it. It's challenging. It's been a little bit of everything over the years, but I'm fortunate to have a wonderful assistant and blessed to have so many wonderful leaders and physicians of the HCMA. We are one of the most successful and well-respected associations in the state of Florida. And so I am just thrilled to be part of it. And it's nice to hear from all of you tonight.
So hear, hear to
work.
Debbie and Elke, huh? Come on,
Yeah.
raise those glasses, ladies, even if they're empty.
Empty glass.
Good job. Thank you.
They're in Chicago, Debbie. I'm from Skokie, Evanston.
Okay. I was South Side. Well, I don't know about the South Side, Oak Lawn, Evergreen Park, Chicago Heights area. Yeah, I love Chicago, but only to visit, to visit and come back.
And we still have a house in the Berkshires, Rebecca. Yeah, in West Stockbridge. Do you know Susan Moore by any chance?
Susan?
Moore, she's a pathologist.
No, I don't. But my house, I still have a house in Richmond.
You do? That's just right up the road from me.
That's right.
Up there.
Yeah, in fact, that's part of the plan for retirement, is to get out of Florida in the summers and spend our summers in the Berkshires.
Yeah. Well, I put my charts on a zip drive so that I can work from up there 3 days a week. Yeah.
Oh my goodness, that's great. So where in West Stockbridge?
On Swamp Road.
Oh, okay.
6 acres up on a hill. Yeah, it's nice.
Well, perhaps we could have our next meeting up there, huh? Our retreat up there in the Berkshires. I mean,
that would be great.
Where were you born in Minnesota, Becky?
In the southwest corner, a town called Slayton, about 90 miles east of Sioux Falls, South Dakota. So that was
Okay.
the biggest big town nearby.
Okay. I was born in Crookston, but left when I was 2 to go to Nebraska. And
Oh,
Yeah.
I know Crookston. My sister went to nursing school in Crookston.
okay, but certainly a Norwegian heritage.
Yeah, Ringenberg. Well, Janssen.
Well, I was a Nelson at birth. The Ringenberg came later. Stepdad.
Very good.
Thank
Look at
you.
look at all the ladies that missed this gathering tonight, huh? Elke, we're going to have to jump on them, huh?
No, I'll send out a little thing saying you're really doing a great thing.
And Dr. Butler was one of them.
Wow. I guess she already must think she's gotten to know me over the years.
How many people signed up for the meeting tonight?
13.
14, yeah.
14.
How many women members are there?
I'm going to guess 230
Woo,
or
wow.
263. I'm not exactly sure, but almost 300.
A lot, yeah.
Oh.
Not more than in the past, that's for sure.
You'd have to get a bigger Zoom account.
Well, we're looking forward to having in-person meetings again and having maybe a nice little happy hour in person somewhere one day soon.
Yeah,
That would be nice.
we hope so. We hope so. Yeah.
And hopefully we will be able to have our membership dinners again in person. We are planning for September. Dr. Silverfield will be installed, very private group in his home. But he'll be installed officially. We will send it out to the membership. We'll put it on our website, just like Dr. Cromer last year was installed virtually. But we're hoping that September we'll be able to go back to our membership dinners at the West Shore Grand Hotel, and if not, you know, we'll make it work. You know, we're doing so much, and you know, like Elke and I talk, you know, about this past year we have been busier than ever, just in a different way, and we've accomplished so much this last year. So we're just, you know, really excited about everything that we've been able to accomplish. We've had more webinars and town hall meetings and Zoom meetings. In fact, we've had more meetings than when we had in-person meetings, and that was a lot because they're always in the evening. And the silver lining is that we have more participants. Whenever we have committee meetings and executive council meetings, board meetings, we have more attendees than when we had the in-person meetings, and more participation, and even have accomplished more. So that's the silver lining in all of this, is that, you know, we've still been able to move forward and do things that, you know, we were very worried, you know, over a year ago, you know, how is this going to work? So I know that going forward, we will still have a lot of Zoom meetings because it actually benefits the association, and we're able to have a lot of more of our physicians participate, but we're also really looking forward to our receptions, our membership dinners, and getting back to those too.
But then we'll have to dress up, Debbie. I mean, I have my pajama bottoms on. Come on.
Let's take a poll to see who had on regular work bottoms or pajamas.
Who dresses up anymore?
You guys have been great. Thank you.
Of course. Thank you for your time, everybody.
Thanks, everybody. Nice seeing you. Stay safe.
Everybody.
Be well.
Bye-bye.
Bye-bye.
Bye.